Today we'll hear from two sets of NIDLR grantees about how they've implemented KT strategies into their projects. We'll first hear about the LIBRE project out of the Boston University and how they used patient-centered approaches for increasing social interactions among burn survivors. Then we'll hear from Alan Heineman and Linda Ehrlich-Jones from the Shirley Ryan Ability Lab about the Rehabilitation Measures database. And later this afternoon, we'll be joined by Dr. Diane Finegood from the Center for Dialogue at Simon Fraser University, who will discuss knowledge translation in the age of complexity. And at the end of the day, we'll have another interactive discussion, which will be led by Kathleen Murphy. And for additional information about these sessions and presenters, please take a look at our conference webpage, which you can find in the Helpful Links pod. All right, so let's get started. We'll first hear about the LIBRE project. Louis Kazis is a professor of health policy and management, the director of Health Outcomes Unit in the Department of Health Law, Policy, and Management at Boston University School of Public Health, and is the principal investigator for the LIBRE project. Colleen Ryan is an associate professor of surgery at Harvard Medical School, and she serves as co-chair of the American Burns Association organization. Dr. Ryan has led efforts to develop disease-specific PROMs, or patient-reported outcome measures, to measure outcomes and define the health needs of burn survivors. Jeffrey Schneider is the medical director of burn, trauma, and orthopedic rehabilitation at Spaulding Rehabilitation Hospital, division chief of the Comprehensive Rehabilitation and associate chair of physical medicine at rehabilitation at Harvard Medical School, and director of the Rehabilitation Outcomes Group at Spaulding Rehabilitation Hospital. He is also PI and project director of the Boston Harvard Burn Injury Model System. We also have Mary Slavin, who is the research assistant professor in the Health Law, Policy, and Management Department at Boston University School of Public Health. And Dr. Slavin has been involved in the development of several rehabilitation outcome measures and has engaged in knowledge translation efforts to promote implementation of these new outcome measures in clinical settings. Dr. Kazis, are you ready to begin?
Sure, whenever you say.
All right. You're up.
Okay, I'm delighted to be here today. And first I want to thank the KTDRR and AIR for featuring this conference. We're delighted to be part of this. And I think you've already stated our backgrounds. I just want to mention that Dr. Ryan, Dr. Schneider, and Dr. Slavin are members of our team, and we've worked together for a number of years. We're a very cohesive group, and I think that you'll agree after our presentation that I think our project is really a contribution to the field. Next slide. In terms of disclosures, I want to thank the National Institute on Disability Independent Living and Rehab Research for supporting this project. We're now in the 5th year of what's called a DRIP. And this particular project has given us an opportunity to develop what is the LIBRE Profile, or CAT. I also want to give credit to the Fraser Fund of the Mass General Hospital, who've also been involved in this effort. So as far as staff and investigators, we're a multidisciplinary team of very talented people who are a lot smarter than I am. And I've become more of a coach in the later years of my career, and I think it's been just a pleasure to work with all of these folks. I also want to make special mention of Alan Jetty, who was a co-PI with me on this project and really brought me into the technology and the approaches used to develop computer adaptive tests. I also want to make mention of Amy Acton of the Phoenix Society, who's been an active participant in this project and really allowed us to enfranchise the burn community nationally in our efforts. Next slide. The LIBRE Clinical Advisory Board is in fact a multidisciplinary group of clinicians and others who've been engaged in the work that we're doing for a number of years and play an important role in terms of work in the dissemination activities that are now proceeding with the LIBRE profile. And Mary Slavin will be talking more about the dissemination efforts later on in this talk. So the agenda today is going to be to provide some understanding of the objectives of this project from the first year. And I do want to say at the outset that enfranchising the burn community in our work has been, I think, one of the primary goals, which I think in some respect we've been able to achieve, and have played an important role in the development of the CAT. We'll talk briefly about the conceptual framework, the methods in the development of the computerized adaptive test, some of our results, which I think have been quite supportive of the reliability and validity of the assessment. And then we'll turn to the dissemination plans and the important networking of our activities with both the Phoenix Society as well as the Boston Harvard Burn Injury Model System. And Jeff Schneider will be talking about this. So I'm going to now turn to Colleen Ryan, who will talk briefly about the clinical implications of the CAT and its importance in the burn community. Colleen?
Thank you, Louis. Can you hear me?
Yeah.
Well, I'd like to begin talking about the overall root of this project. When I began as a clinical burn surgeon almost 30 years ago, there was one outcome that people really cared about, and that was mortality. And around 1984, it became standard for people with large burns to survive. And in the ensuing years and throughout my career, it became evident that we needed to look at outcomes other than simply survival and move towards quality of life in the evaluation of our therapies for patients with massive burns. Now, as you can imagine, entering the society with severe scars can have some significant social implications. And there's really little known about that, and actually little known about the long-term outcome of burn survivors and how they navigate the rest of their lives following these severe injuries. So what we were hoping to do is to look at long-term outcomes of burn survivors. So the first thing we wanted to do was identify the needs of the population. We wanted to know really what happens to burn survivors, physically, mentally, socially, and we could do that by collecting large volumes of data and examining it. We also would like to optimize care. For instance, if we had our long-term outcome measure, we would like to compare one treatment against the next and determine which one most efficiently reaches our goals so that we can streamline care and improve recovery. Once we have these large bodies of data, we may also be able to use them at the individual level and provide real-time feedback. For instance, suppose you had a massive burn injury. You came out of the ICU, you went home, you're there with your wife or your significant other, and you have to go to the doctor's office. And it's 3 months after the injury, you're still doing a lot of dressings, and you go in and you have maybe 40 minutes with your doctor in a very extensive long appointment. Well, you go in, the doctor asks how you're doing, and it's very hard in that short amount of time to explain the magnitude of the disruption of this injury in your life. You really don't even know where to begin. And during that 40 minutes, you have to have your dressings done, you have to talk about pain, you have to have your medications reviewed, you need to schedule your next surgery, you need to do consent. And there's really a limited amount of time where you can talk to the doctor or the caregiver to explain what is going on with you. And we were looking at the possibility of patient-reported outcome measures done before the visit to help explain to the doctor, particularly when they're benchmarked against known results, how you're actually doing. And also, the caregiver can then provide to you, the patient, how you're actually doing by benchmarking your results against those of others with similar injuries. When we began this project, I think it was important to involve survivors from the very, very beginning. And this was through focus groups, committees, having survivors actually work alongside us on these measures. But we asked them, what is the most important outcome to you long-term following the burns? And in addition to scarring, it was social participation. So with that, we went on to look for a measure of social participation. And we wanted to make sure that it was relevant, accessible, and useful. And we did this through an ongoing collaboration with Phoenix Society, which is one of the leading burn survivor organizations in the United States and Canada. So our objective was to create a measure of social impact of burns in adults. And we called that the Life Impact Burn Recovery Evaluation, or the LIBRE Profile. And this is our little trademark here. So the implications for survivors of such a measure would be that we would understand what challenges are faced by burn survivors over the course of their recovery. We could be able to define it with numbers and in a hard or in a fashion that we could compare one treatment against the next, and we can sort out which resources or therapies are most effective in improving the burn survivors' social participation and streamlining their recovery. And we could also provide survivors and families and health providers and even administrators with important recovery information. In some of our pilot work, some people say, finally, it's organized in my mind so I can understand how to approach it. And I have an expectation of how long, for instance, I'm going to be out of work. It helps the survivor explain to their families. It helps the health providers understand the context of their illness. And it also helps administrators and third-party payers with resource allocation following massive injury. Finally, it enables the survivors to better understand the recovery and also to communicate their needs to doctors and others. Now, for instance, you take a test before you go into the doctor's office. When you go into the doctor's office, there's a complete list of how you're doing in all these areas. And if you're doing well, it's perhaps a green, you get a green number on that. And if you're underperforming, that's indicated. If you're overperforming, that's doing as well. We've had some success from previous measures doing feedback. For instance, the Shriners, Hospitals for Children, American Burn Association burn outcome questionnaires. An example of this clinically would be a mother that comes in with the child very, very upset about how things are going. They take the instrument and then the results are reviewed with the mother and everything is green except for parental worry, which was really very low. And in a very concrete fashion, you can explain to the mother that the problem is her worry and not so much the child who's doing well. So with this sort of experience in mind, we went on to develop the LIBRE. Dr. Kazis now will talk about the LIBRE project.
Thanks, Dr. Ryan. Thanks, Colleen. So as Colleen indicated, I think that very early on, from the beginning of the project, we began to really enfranchise the burn community and also clinical experts. And in doing so...
Hey, Dr. Kazis, would you speak up just a tad? We're having trouble hearing you.
Sure. In doing so, we created an item pool. Now, the item pool involved qualitative work, and also comprehensive lit reviews and consulting with clinical experts. And we were interested in developing items that in fact emanated in a number of respects from what the needs of the burn community were and the burn survivor, as Colleen indicated. And this became, I think, an important starting point for the project. We clearly communicated to those burn survivors that we worked with that the information that they were providing would ultimately lead to the development of an instrument that would help to understand the outcomes that might be important to the burn survivor. We then created an item pool on the basis of this, and I'm going to go into some detail about this. And this item pool was in fact a fairly lengthy questionnaire that was then administered nationally to over 600 burn survivors. And we were able to do that through the networks that we created or that we tapped into through such organizations as the Phoenix Society that were very important in the foundation of this. We then conducted calibration work in the third year, and as I indicated, this is a 5-year study, and validated the assessment tool that was being developed across 6 domains that I'll detail in the coming slides. We finally conducted in the 4th year a pilot study, and the pilot study was to look at the reliability and validity of the computer adaptive test assessment. We also have created not only a CAT, which is computer-based, but also a fixed form assessment, which can be administered through paper and pencil or on computer. And this fixed form assessment provides basically scores that would be on the same metric as the CAT. And then finally, in the 5th year, we're beginning to conduct alpha testing as part of the dissemination activities of the project. And as I indicated, Dr. Slavin will be talking about this later on in the talk, as well as Jeffrey Schneider, who in fact is the director of the BHBIMS project or program. Next slide. So we're now entering the 5th year of the project, and we've had a number of publications. For those that are interested in this work, I just want to mention that they can turn to any of these that will provide the details concerning the methodology, as well as the applications of the LIBRE Profile. There are now 6 of them that have either been published or have been accepted for publication, and we can make all of these available to any of you that are listening in on this conference. Next slide. So the conceptual framework development in the 1st year, it included performing a comprehensive lit review and consulting with clinical experts and burn survivors about the social life areas impacted by burn injury. We used the International Classification of Functioning, or the ICF, WHO's ICF, as the primary grounding of this content model that we developed, that we used in the context of the development of the assessment. And then qualitative results strongly suggested that the conceptual model fitted the constructs for societal role and personal relationships with the respective subdomains, and we'll be talking more about that. We also conducted specifically focus groups to validate the framework and revise and augment the initial item pool, and then we conducted cognitive interviews with the burn survivors to assess clarity and consistent interpretation of the items that were developed. Next slide. So the conceptual framework, and many of you are probably familiar with the WHO International Classification of Functioning, includes the health conditions, the disorder that, in fact, in this case, we're talking about burns, body functions and structures, which lead to activities, and it all sort of focuses for us in terms of participation as far as the social role aspects for the burn survivor. Once they're burned and have a major impact on their lives, how does that impact on their social participation? So we also consider the issues around environmental factors and personal factors that may impact on that participation. Next slide. So the process for this included sort of initially, we picked out 19 measures amongst many others that in fact we looked at in terms of this comprehensive lit review that included initially 560 items. We then removed those items in which they were less relevant or in fact led to a lot of redundancy. That provided us with 276 items. We then conducted focus groups amongst the burn survivors, and also we went to clinical experts as a way of culling the assessments and basically modifying some of the others. That actually increased our item pool then to 315 items. We then revised and removed items, again, that were tended to be redundant or less relevant. That led to 253 items. And then finally, we conducted cognitive testing for further item refinement, which then led to a little under 200 items for this battery. We then administered the battery, as I had mentioned, to over 600 burn survivors, and that provided us then with the database that would be used to do the calibration of the items. Next slide. So how does a CAT work? Well, I think almost everybody on the phone, I would assume, has taken an SAT or a GRE exam. The methodology is where there's an extensive item bank behind the scenes, and given the technology and the science, which is based upon what's called item response theory, only a select number of items have to be asked for that individual from that item bank. Every response to an item will inform the system as to what that next item to be asked will be. And I'm going to turn to the next slide to provide a little more definition for this. So a CAT is called a computer adaptive test. And this, as the slide reads, is an estimation process that begins with a large item bank where the items are ordered according to their difficulty level. The CAT then selects an item of medium difficulty to start with. If the person responds positively to that item, then the next item will increase in difficulty. On the other hand, if the person responds negatively, then the next item will decrease in difficulty. So the test continues to ask these questions until a sufficient level of precision occurs. And that would be a standard error of less than 0.32 for the methodologists out there, or a reliability that's 0.9 or higher. We also include stopping rules within the algorithm so that no more than 10 items will be asked and a minimum of 5. But that does provide us with sufficient reliability based upon the work we've conducted to give us 0.9 or higher reliability for the domains. Next slide. Let me just also mention that the methodology we use is called a graded response model. It's 2 parameters, and it does allow us to establish different slopes for the items. So that does, in many ways, for those that are familiar with the PROMIS system out of Northwestern, they also use the graded response model approach. In terms of the methods, we then conducted field testing once we collected the data. We also conducted exploratory and confirmatory factor analysis and then applied our item response theory using a graded response model. Next slide. We found that there were 6 domains related to social participation, or what I call social reintegration following a burn injury. These include relationships with family and friends, social interactions, social activities, work and employment, romantic relationships, and sexual relationships. So these are the domains that turned up given our analytic procedures that I just mentioned. Next slide. So to explain just a little bit about each of the domains, and again, one can turn to any of some of our publications which will detail these quite a bit. The first is relationships with family and friends. And this involves the person's ability to interact with, fulfill social obligations, and achieve emotional satisfaction with family and friends. So that's relationships with family and friends. Social interactions involve exchanges and contacts that a burn survivor experiences when engaging in various community activities that are important to them and include several items on relating with strangers. An example might be, I don't worry about other people's attitudes towards me. Next slide. For social activities, that involves burn survivors' perceived difficulty with engaging in social and community events and obligations. An example of that might be, I avoid outdoor activities because of my burns. Then there's work and employment. This might be satisfaction with one's ability to complete work and relationships with coworkers and supervisors. Because of my burns, I'm unable to finish many work tasks. So work and employment was clearly a domain that really came out of some of our focus groups and was shown to be an important aspect of a burn survivor's social role. Next slide. Romantic relationships and sexual relationships were made up the fifth and the sixth domains. And romantic relationships have to do with emotional and physical aspects of those relationships, as well as communicating with a partner. An example might be, I have a partner who meets many of my emotional needs. And then finally, sexual relationships relate to engagement in and satisfaction with one's current level and quality of sexual activity. An example there might be, I avoid sexual contact because of my burns. So those were the 6 domains, and empirically they were shown to establish 6 factors based upon our database. In the 4th year of the project, we conducted pilot testing using the fixed forms, and there were 10 items per domain, or 60 items in total for the fixed forms. We conducted test-retest reliability and validity testing of the fixed form CAD, I should say the fixed form LIBRE profile. The test-retest reliability involved administering the fixed form and then re-administering the fixed form 7 to 10 days later, so a lag of about 7 to 10 days. The validity testing involved using legacy measures. We correlated those legacy measures with our LIBRE profile scales. And let me mention that there were about 250 subjects that participated in the initial test, and where we conducted our validity testing. And for the test-retest, the numbers were about 150 or so that completed both test and retest. Next slide. The results were quite encouraging, and we do have a manuscript that is now under review with the journal. All correlations between the LIBRE profile scales and the legacy measures were shown to be significant at least the 0.05 level. And we found that they were in the expected directions when we looked at the issues around convergent and divergent validity. The figure below that is the test-retest reliability, and that was shown for, in this case, an example being social activities, where the correlation was close to 0.9. For the other 5 constructs or domains, we found that the correlations ranged between 0.8 and 0.9. So they were all encouraging. So the results in the 4th year have been quite encouraging in terms of both the reliability and validity of the LIBRE profile assessments. We've now begun to put the LIBRE profile into a CAT, a computer adaptive test, and that is clearly available in a desktop format, and we're now moving to a web-based application, which will allow it to be administered on any number of elements, including laptop, desktop, and other devices. So we're now in the 5th year of the project, and we're beginning to look to alpha testing across different environments, both clinical and in the community. And I'm going to turn things now to Mary Slavin, Dr. Slavin, who will talk about the dissemination activities.
As you've seen from the previous talks from Dr. Ryan demonstrating that we clearly have something that is of value to the burn community, and from Dr. Kazis we have something that's scientifically sound. we're now at the intersection between having something that's a wonderful research initiative that we now want to make available to the community. So from the very beginning, we began to think about how we're going to get this tool available to our potential users. We identified our 3 potential audiences as people with burn injury, researchers, and clinicians. And then we started to think about how to get this computerized adaptive test available to the broad community for use. And this is not a very easy process. It requires collaboration between researchers and people involved in developing technology. So, as Dr. Kazis mentioned, we're at the point where we have a measure, the computerized adaptive test that we think works well. It fulfills all of our criteria for a good measure. Now we have to make it available. And we were fortunate that we were able to find a group at Boston University, the Software Application and Development Lab, and they worked with us to develop a web-based platform. So what you're seeing here is a screenshot of the computerized adaptive test web-based platform that they've developed for us. And we've just completed our beta testing of this platform. It works well. We also have a desktop version that we can make available to people who are interested in using it, sharing that desktop version. And we also develop short forms for people who may be interested in using the LIBRE Profile but are not able to access any computer for administration. So again, we've been looking at this online CAT, and if you can go to the next slide. This is an example of the way the items appear. As Dr. Kazis mentioned, we have the items specify your level of agreement. Most family members are comfortable being with me, and then the respondent selects what they feel is the most appropriate response. And so the respondent will go through the computerized adaptive test, and the slide that previous slide that showed you, with each new response, the computer selects an item that best matches that individual. So with a few well-selected items, we can get a very precise estimate of a person's a level of a certain trait that we're assessing. Next slide. In addition to developing ways to present the LIBRE profile in terms of having access to the computerized adaptive test, we're also very interested in score reports. We feel that score reports are very critical to whether or not something is used. If we're just giving a user a response that your score is 45 or your score is 60, it may not have as much meaning as if we can present the score in some context. So we've come up with some ways of presenting the score reports, and we just went to a World Burn Conference and administered some of the LIBRE Profile assessments and demonstrated some different score reports, and we're now looking at data from the respondents to determine what are their preferences for displaying scores. And our goal is to have score reports that are deemed valuable and useful by the 3 different potential users. Next slide. So in terms of the more traditional types of dissemination, I feel very fortunate to be working on this project because the dissemination is quite easy because already we have some of the criteria met in that we have a demonstrated need, as Dr. Ryan mentioned. As soon as people heard about this project, there wasn't a lot of explanation needed in terms of why this would be an important project. So there was an immediate recognition of the value of this, the LIBRE profile. We also had the advantage of having key opinion leaders of Amy Acton and Drs. Ryan and Schneider to help lead the effort. So having leaders in the field, I think, was critical to having recognized the value of the LIBRE profile. So in terms of our dissemination partnerships and collaborations, they've been in place since day one, and I think they've really made my job much easier. The Phoenix Society, again, partnering with a consumer organization was critical to our success. The Boston Harvard Burn Model System was also an important collaborator. I don't know if you've lost the Adobe presenter. Okay. We also have our local burn survivors of New England group who have been incredibly involved with us from the very beginning. They are so excited to work on this project, and they're very enthusiastic, and Dr. Kazis is on their advisory board, so we have a lot of interaction and exchange with them. We see them almost every other month and have some providing regular updates and getting input from them. Also, we have the LIBRE Clinical Advisory Group, a group of burn injury experts from across the country who meet with us on a regular basis. And we have the National Fire and Protection Association, again, another outside group that we work with. And you see the BU College of Communication. I'm sure some of you might have noted the graphics that Dr. Kazis presented in terms of some of the infographics, and we have been working with the BU College of Communication. I think they've really strengthened some of our ability to create compelling images and to tell our story. Next slide. So throughout the project, we've been able to collaborate with the Phoenix Society, and we do a lot of cross-promotional activities. So when we're promoting one of our presentations, we highlight the Phoenix Society and vice versa. We develop brochures and more traditional promotional materials. We're engaged in social media. We are very present at conferences, and when we complete a presentation at a conference, we will upload the presentations to our website. We have an electronic newsletter that we distribute via email marketing campaigns, and have seen a continued growth in our interest in our newsletter. We also have taken advantage of collaboration with BU Film School and the BU School of Public Health to develop videos, and we'll show you some examples of the videos we've produced. And again, I wanted to mention the BU College of Communication. They do have this wonderful group called Ad Lab. It's a student-run ad agency, and they have been engaged since day one with the logo development, infographics, and graphic designs. And I think when you first see the LIBRE profile, the image is compelling. Next slide. You can see us here at the World Burn Congress, and when you see that the logo of the LIBRE, I have to give credit to the BU College of Communication Ad Lab students for coming up with a very compelling image. We've created a brand that I think people recognize. We started from people not knowing what it was to people asking questions about it. So we've become a recognizable group within the burn community, and people are aware of what we're doing. So most recently at the World Burn Congress this year, we did a practice improvement study where we demonstrated the LIBRE profile among attendees. They gave a feedback survey, and we were analyzing our results from that now. And then for participation, we gave a donation to the Phoenix Society. We had an exhibit booth, as you can see in the photo, where we have promotional materials and newsletter signups. And then we were able to get some footage for a consumer-focused video that we're producing. We had interviews with 5 burn survivors, and we had filming at the Walk of Remembrance. So again, we're capitalizing on these opportunities to engage with the burn injury community and strengthen our materials, our dissemination materials, and our presence in the community. Next slide. So again, throughout the project, we've been involved in the Phoenix Society. We've been involved with burn survivors. We do very little without consultation from our burn survivor community. And we're involved with clinicians and research partners. And we're planning ahead to see how the LIBRE profile will be used in the future. So in terms of identifying and engaging our audience, we began early on with the LIBRE profile development. So when we first started, I can almost remember our first conversation where we said, we have something, we don't have anything to disseminate yet. What are we going to do? Where do we start when we don't have a product yet? So we began by trying to prepare an audience for what our future product would be. And we had stories of social participation told by burn survivors to develop an interest in this as an issue and a topic. We had newsletters that emphasized burn survivor stories. We had a public service announcement that was again produced by a student at the BU Film School. Next slide. It's had nearly 1,000 views on our YouTube video. We have a brochure, which, again, nice infographics developed by the ad lab at the BU Com School. We want to tell our stories simply, but in a compelling way. We often have quotes from our burn survivors that are, I think, driving a lot of interest and understanding in what we're doing. Next slide. And this is just the first scene of a public service announcement video that we did in the very early stages. We were, again, trying to build our audience and build an understanding for the need for our product. So we created this JustSmile video, worked with our New England burn survivors group, and they helped to have roles in the video. And we produced a video that basically showed some of the issues around social participation, with the message that what people with burn injury want from the public is to just treat them normally and to just smile and not be no avoidance behavior. And again, we've had over 1,000 views on our YouTube video where we posted it. Next slide. And what we're producing now is a clinician-focused video. That looks very dark. That's the that's the entrance to the BU School of Public Health. But it will be. We have a video that was produced with Dr. Kazis and Dr. Ryan, and it focuses on why clinicians would want to use the LIBRE Profile. And it's about, I think, 6 minutes. And we will use that again as part of our promotion to clinicians in developing an interest in using this tool. Next slide. And then for our future work, we have, again, the work that we did at the Burn Congress this year. Our next video will be the Burn Survivor focused video, so where we have a video to engage clinicians in their interest in the LIBRE Profile. Our next video will develop an interest among burn survivors as to why they might be interested in the LIBRE Profile. We continue to update our brochure and promotional materials, and we're now at the stage of finalizing our training materials so that when we have our web-based LIBRE Profile, we will embed in the website our training manuals and how-to videos. Future work will be continued developing testing of our CAT at clinical sites. We have a desktop version, a short form, and an online CAT, and we're working with, we're in discussion of working with some of our clinical sites to do some online testing. And then our goal is to provide the LIBRE Profile CAT in homes through websites like the Phoenix Society. So we will embed the LIBRE Profile CAT in relevant websites where people can go and access the tool.
Great. Thank you, Dr. Slavin. So I'm now going to introduce Jeff Schneider, Dr. Schneider, who is a rehab physician that was mentioned, professor at the Harvard Medical School, who will talk about the BHBIMS project in the context of the LIBRE Profile, which will be one of the next stages in the dissemination to the burn model system. Jeff?
Hi, thanks. Thank you, Louis, for the introduction. And can you all hear me?
You might want to speak up just a tad, please.
Okay, great.
Thank you.
So the Boston Harvard Burn Injury Model System is really excited to be involved in sort of one of the next major steps with the LIBRE project. And the BHBIMS is one of 4 burn model systems that are funded by the National Institute of Disability, Independent Living, and Rehabilitation Research across the country. And as part of our grant this cycle, which actually just started a month ago, and as part of a 5-year project, our major research project is going to be developing recovery trajectories with the LIBRE project. So when we speak about recovery trajectories, some people might think about this idea of like a pediatric growth curve, but this is really using the LIBRE scales as the metrics that we'll be examining over time to create these trajectories and looking at these different 6 social constructs or social outcomes over time. And so, you know, what are the sort of the benefits of developing recovery trajectories for the burn population? I think for one, it enables one to enhance our understanding of the social changes that occur over time for burn survivors. Some issues may be more pertinent at certain time points, and others may linger and remain issues later, and those are things we're still trying to figure out. Another important implication is that it will help us identify risk factors associated with the development of specific social recovery trajectories. For example, certain factors like demographics, gender, marital status, different medical factors may be ways of stratifying risk for development of different trajectories of recovery in these specific areas of LIBRE scales. Another implication is that it will help us evaluate clinical interventions that address social integration outcomes on both an individual and a population level. So if we try a new intervention, we can not only look at an individual and put them on a scale and this recovery trajectory and see how they respond, but also compare whole groups of people to that scale over time. Another important implication is it will enable actually burn survivors themselves to self-assess their own social integration recovery. And by taking this LIBRE profile either in the home, in their own setting, they can sort of benchmark how they're doing compared to others. And it gives a platform for both burn survivors and their clinicians to assess their social recovery and facilitate individualized care plans. So to guide sort of what their own needs are according to how they're doing in this trajectory. And then ultimately it will help guide the development of social integration resources for the burn survivor community as a whole. So in order to do this, we're going to be looking at the 6 LIBRE Profile scales, which include family and friends, romantic relationships, social activities, social interactions, sexual relationships, and work and employment. And we'll be administering the LIBRE Profile to 600 participants over the span of 5 years. And we'll follow those participants for up to 2 years time period. And they'll receive actually 5 administrations of the LIBRE Profile over that period. So that gives us repeated measures in order to assess this trajectory of recovery. And people will be administered the LIBRE Profile CAT either online or by mail short forms or even by phone interviews in order to make this as accessible as possible to the burn survivor community. The image here on the right is some prior work we've done with a different instrument, the YABOQ, the Young Adult Burn Outcome Questionnaire. And this is really just to give sort of an analogous picture of what we hope to develop, which is these trajectories of recovery. So we've done this sort of work before with other instruments, but they haven't really been done with the LIBRE Profile or other social participation outcome instruments in the burn survivor community. And so this enables, you can see a trajectory of recovery over time. This is in months on this figure. And you can see a curve that is generated over time. Then an individual can plot themselves on this curve. And this curve happens to have 2 different lines which are stratified by the severity of the size of the burn. So this is just an example of the type of information we'll be able to generate from these recovery curves. Next slide, please. So as we're all speaking about, one of the major important aspects is how do we get this information from the research side to the people who need it most and disseminate it. And so we've thought about the dissemination of this project along different audiences. So when we think about the clinicians and the researchers, we'll be presenting our results at the major scientific conferences, which include the American Burn Association. We'll be publishing manuscripts in peer-reviewed journals. We'll be collaborating with the Model System Knowledge Translation Center, which performs quick reviews, which are basically consolidated information based on peer-reviewed manuscripts and puts it into more accessible language, which is readily available for the lay public to interpret scientific literature. And we'll also be producing graphical abstracts, which are sort of one of these nice new visual ways of understanding research results, and are being widely disseminated in social media as well as in now traditional academic journals. And when we think about the burn survivor and family community, we'll be having workshops at the World Burn Congress, which is a national and international conference each year, really dedicated to burn survivors and their families, about the use of the recovery trajectories in the LIBRE profile. We develop fact sheets, which are geared toward the consumer audience, and highlighting our social media presence on both Facebook and Twitter, and then also having consumer sessions at local support and national support group meetings. And then when we think about all the stakeholders together, we'll be developing a LIBRE Profile toolkit, which will really be an interface that will help both clinicians and researchers, as well as burn survivors and their family, utilize and sort of help them walk through how to make use of the LIBRE Profile and these recovery trajectories. And that toolkit will look a little different for a burn survivor and how they would walk through the use of the LIBRE Profile recovery trajectories versus a researcher who might be looking for different types of way of interpreting the data. We're also planning to have a symposium at the end of our project on community participation following burn injury, which will help tie together the work that we do and bring together the different stakeholders who are really invested in this work as well, and really helping us disseminate it. Next slide, please. So I don't know, Louis, do you want to conclude with this slide here? Yeah.
Thanks, Jeff.
Yep.
So let me just mention, in terms of connecting with us, we have a website for the LIBRE Profile, and I also want to mention that there is a website for the BHBIMS, and we are well integrated with that website as well, as we work closely together with Dr. Schneider and Dr. Ryan. And we also have locations on Facebook, Twitter, although I encourage you not to Twitter the White House these days. And then we have an infographic. We have PSA as well, and you can contact us directly, and we'll be glad to answer any questions that you have. So I want to thank all of you, and I also want to thank my colleagues who presented. So I guess we can start now with questions. And do I take the lead on this, or okay? I guess I do take the lead on this. So I'm gonna respond first of all to the technical questions that were asked. The CAT infographic actually was developed by one of our student organizations. Let me mention that, and they literally spent a semester developing that. It was actually at the time at the request of Dr. Jetty, who wanted a slide, and it has become very helpful to us in explaining what the CAT is about. The next question by Dr. Chang, are all LIBRE items co-calibrated together? The answer is no. They're treated on a domain basis. So that answers that question. One thing I didn't mention is we did conduct an internet-based survey of non-burns, those without burns, representing a national, it was actually a sample of the U.S. Let me put it that way. I have to be very careful these days when you deal with internet-based surveys as to whether they're nationally representative. But this was non-burned, and it does provide us with an ability to norm our scores using a T-score transformation. So the 50 in our metric represents those without burn injuries. So that's in fact what the 50 represents. It's on the basis of this internet-based survey. The other question, I guess, had to do with differential item functioning and DIF, and we did look at that, and there was a difference between males and females, and we did separate calibrations for the two. But the other assessments that were done for DIF did not present a problem. So I think that answers those questions. The question at the top involving the National Quality Forum, I've been part of some of their efforts. They're very it does require a lot of labor. The applications for endorsement are very extensive and require a lot of time invested. So with appropriate resources, I think it's a good idea, but it would require a lot to be able to basically put the application together for consideration by NQF.
Hey, Louis, would you mind reading the questions that you'll be answering from the chat box, just so we have a good reference point?
Okay, so are you seeking National Quality Form endorsement? Your process is clearly rigorousness. Well, thank you, Elizabeth, for that comment. If we were able to have the resources available to do that, I think that's something that we would certainly consider. And then, did you conduct a literature review at the start of your 5-year DRIP project, or had you already completed that and identified the item pool? The answer is no. We began with a comprehensive lit review once the DRIP was supported, and all of that work, or most of that work, occurred in the first year of the project. I'm going to let Mary respond to that, since that's more of a dissemination.
Yeah. Kathleen Murphy, had you worked with your partners and collaborators on past projects, or was this a new constellation of entities? You know, I think that Dr. Kazis had been working with the Drs. Ryan and Schneider on burn injury assessments, but and had some collaboration with the Phoenix Society, but bringing this effort under a DRIP really formalized the relationships, and it brought in the dissemination piece, which I don't think was often a big feature of this kind of work. And I do think we've learned through the project that some of the big barriers to using the instrument they're significant in terms of the technology needed to support the platforms that have to be developed for these instruments, the score reports, the training, and that sort of thing. So I think the DRIP really brought us together into a new constellation of entities that had a broader vision of producing a product and end result that will be used. Yes.
Thanks, Mary.
Yeah.
So the last had to do, did you analyze results for differences by gender, location of burn, and severity of burn? And the answer is yes, we did. And that's a good part of that, I think, is documented in some of our publications, which I'd be glad to send on to those, and perhaps to Margaret, who's asked the question.
Well, thank you very much. We really appreciate your presentation this afternoon. I know there were more questions coming in, but perhaps, Mary, you'll be in the interactive session later this afternoon, so you can answer the remaining questions then. So,
thank you very much.
Thank you all.
Thank you.
Thank you.
Thank you very much.